So, Barbie and I have been best friends for the last 18 years, but over the last few years, her friends and I have noticed that her behaviors have started to change. So, we start to get concerned for her, and we decide to have an intervention. I guess you're wondering why we gathered all together like this. Well, Barbie, we think you have a problem. This is an intervention. We want you to get help.
What are you talking about? Well, sometimes you seem really depressed. You won't answer our calls, you don't want to go skateboarding. You love skateboarding.
You used to be a champion baton twirler. When was the last time you picked up a baton? And when was the last time you hit the slopes?
Okay, sometimes I get a little upset. But I'm fine now. My life is going wonderfully. I've got an amazing husband.
That you met and married in Vegas?
Yeah, Barbie. When you're not withdrawn, you're a whole different person. You make these wild decisions. Remember that time you spent $12,000 on that dress? Where are you ever going to wear that thing? What were you thinking? Yeah, Barbie. That's not normal.
And remember that time when you called me screaming about the beast being after you? You were obviously hallucinating. Sorry. What? Did you say something?
Are you even listening to what we're saying? Barbie, please, get help. Go see a doctor, if not for yourself, then at least for us.
Fine. I'll see a doctor. And I'll prove to you guys that you're exaggerating. There is nothing wrong with me. I can't believe my friends would say such horrible things about me. I mean, what are they thinking? You know, I think I am going to go to a doctor. I'm just going to go and I'm going to prove them wrong. There's no way there's anything wrong with me. Go away. Stop calling. Shut up! I can't deal with anybody right now.
Barbie came to see me because some of her friends had noticed certain changes in her behavior. Barbie said she did experience some periods of depression where she would feel hopeless, worthless, lack energy, and have no interest in normal activities. But then suddenly the depression would be replaced by periods of time when she was feeling much better. She would be more productive, have increased self-esteem, and need much less sleep. However, during these times when she considered herself well, her friends still thought Barbie was behaving out of character. They thought she seemed irritable, inattentive, made impulsive, irrational decisions, and spent excessively. Based on Barbie's history, I felt she presented with the classic signs and symptoms of bipolar disorder, but to be sure, I needed to first run some tests to rule out other conditions. Hi Barbie, how are you doing today?
Oh, I am fantastic.
Great. So, let's review your test results. Your thyroid test came back negative, so you don't have a hypoactive thyroid. The tests for Addison's disease and Cushing's syndrome were also negative. You don't suffer from any neurological disorders such as epilepsy or multiple sclerosis. We know that some drugs and vitamin deficiencies can cause alterations in behavior, but you aren't taking any corticosteroids, antidepressants, anti-anxiety drugs, or drugs for Parkinson's disease, and your vitamin B12 levels are within the normal range.
Okay, so what does that mean?
So, based on your negative test results, your psychological evaluation, medical history, and physical exam, it sounds to me like you have bipolar disorder.
Bipolar disorder? What is bipolar disorder?
Bipolar disorder is a condition in which the patient experiences a roller coaster of emotions, ranging from periods of extreme happiness to irritability and even severe depression. Along with Barbie's signs and symptoms, signs of mania include binge eating, drug use, promiscuity, racing thoughts, or high self-esteem. Signs and symptoms of the depressed phase include difficulty concentrating, loss of appetite, lack of energy, feeling worthless, hopeless, guilty, and in extreme cases, thoughts of suicide. The exact cause of these mood swings is unknown, but it usually begins between the age of 15 to 25. Bipolar disorder affects men and women equally, and the mood swings between mania and depression can be very quick. There are 3 types of bipolar disorder. Type 1 clients have had at least one manic episode and periods of severe depression. Type 2 clients have never had full mania. Rather, they experience high energy levels and impulsiveness that aren't as extreme mania. A mild form, known as cyclothymia, involves less severe mood swings. Clients with this type experience hypomania and mild depression. Cyclothymia is often mistakenly diagnosed as depression.
Okay, so I have bipolar disorder. Is it treatable?
Well, the best approach is a comprehensive treatment plan. We recommend a combination of medication, psychotherapy, education, lifestyle management, and support. The medication we prescribe is a very important part of your treatment. It is a mood-stabilizing agent that can help minimize the highs and lows of bipolar disorder and keep your symptoms under control. Working with a therapist, you can learn how to cope with difficult or uncomfortable feelings, repair your relationships, manage stress, and regulate your mood. Education is a key component of treatment. The more you and your loved ones know about bipolar disorder, the better able you'll be to avoid problems and deal with setbacks. A regular sleep schedule, avoiding alcohol and drugs, following a consistent exercise program, minimizing stress, and keeping your sunlight exposure stable year-round can help keep symptoms and mood episodes to a minimum as well. Participating in a bipolar disorder support group gives you the opportunity to share your experiences and learn from others who know what you're going through. The support of friends and family is also invaluable.
Most people with bipolar disorder need medication in order to keep their symptoms under control. When medication is continued on a long-term basis, it can reduce the frequency and severity of bipolar mood episodes, and sometimes prevent them entirely. If you have been diagnosed with bipolar disorder, you and your doctor will work together to find the right drug or combination of drugs for your needs. Because everyone responds to medication differently, you may have to try several different medications before you find one that relieves your symptoms.
Okay. I guess I should try something. Thanks for the prescription, doctor.
No problem. So it's good to see you, Barbie. How have things been for you?
Oh, life is fantastic. We had a few setbacks with my medication, but once we got the dosing right, it's like I'm a whole different person. I've started skateboarding with my friends again. I've even gone back to my baton twirling. See? Isn't it amazing? I'm so happy with life. Thank you so much. I'm even seeing my psychotherapist. Life is fabulous. I'm so glad that we found out I had bipolar disorder. If I had never known, I don't know how I would have continued on.